Welcome to Bellevue Chamber webcast for Thursday, April 16th, 2020. Today we're joined by Vice Admiral Raquel Bono, Washington State's Director for COVID Health Response, Dr. Thomas Miller, Medical Director for Overlake Medical Center, and Dr. Ed Leonard, Overlake's lead infectious disease specialist, as we explore the frontlines, leadership, science, and Washington's fight against COVID-19.
Hello and welcome. Thank you so much for joining us today. We're trying a little bit of a new format today with a little bit more technology, and so it's entirely destined to go terribly wrong over the course of the next hour. But fortunately, we've got a great panel of speakers for you that will make any of our technological glitches just go by the wayside. We know that so many folks are tuned to the news and to the radio and listening to what's happening next. We know that the curve has been bent and flattened and that things are looking up here in the state of Washington, but we know that there is great risk ahead, both for the economy, but also for us medically. We have got a great panel of experts today that have got extraordinary experience in dealing not only with previous issues in healthcare, but certainly at the forefront of this epidemic. And I want to turn first to our first guest, who really has been a name about town here since she came to the state in the last few weeks to lead our healthcare response to COVID-19. It's really with great honor that I introduce Vice Admiral Raquel Bono.
Great, thank you very much, Joe. And you know, I'm impressed. I saw the lead-in for the intro here, and I think your technological skills are I think they'll be okay. So this will be good. So I just had a couple of slides that I wanted to share with folks to give you a little bit of background on what I've been doing. Many of you know that Governor Inslee invited me to join other Washingtonians in the effort to manage and fight this pandemic crisis. And coming into the state, you know, one of the things that I knew from the start was that there was very strong leadership at the state level with Governor Inslee, and there was also tremendous leadership within the different cities, the counties, as well as in the medical system itself. And the other piece that I was also quite sure of before I came here was the level of engagement that the community had, and so I knew that they were being very responsive to the guidelines that Governor Inslee had put into play. So just real quickly, if we could go to the next slide, and I'm not driving it, so whoever is. Yeah. Okay. I wanted to share what my priorities have been from the very start, and that is to make sure that we're protecting our frontline healthcare workers. And that's a lot, you know, there's a lot of things that we want to make sure, and you've seen in the news, not only here, but in other areas, how important it is to make sure that our healthcare workers and the people on the front lines, whether it's the nurses, the doctors, EMS, and even the staff in long-term facilities, that we're making sure that they are as protected as possible so they can continue to do the work that is so critical to our ability to face this crisis. The other part that was a very strong and a pivotal part of this effort was how do we optimize all of Washington's healthcare resources? How do we make sure that for each of the health systems and the hospitals and the workers that and the clinicians that we have, how do we make sure that we have the strongest capability and optimize the maximum capacity to take care of as many patients as possible? And finally, while I say talking about keeping our Washingtonians safe, it's really not only safe, but to be able to prevent as much harm and death as possible, because we do know that this virus is very aggressive once it starts getting into congregate communities and it preys on some of our most vulnerable folks. So if you go to the next slide, you'll see that some of the places where I've had a chance people that have been very helpful in making sure that I'm oriented and aware of certain issues or some of the organizations that are here in Washington State, and many of them here you recognize. These are very influential elements here across the state, and they have been extremely helpful in helping me understand the lay of the land and where the opportunities are and who I need to talk to in terms of bringing some of our efforts into alignment. The next slide shows some of the places where I have been. Last week, I was able to go to Eastern Washington and spend some time in at Sacred Heart and at Deaconess, and had a chance to not only talk to some of the folks, and actually this is in Yakima. I had a chance to talk to folks there in Spokane and in Yakima, and saw firsthand the preparation that people have made there to make sure that they have enough ICU beds and ventilators for any of the patients. You know, we were looking also at the possibility of whether or not we would need Astria, and because of the work that had been done in Yakima, felt very comfortable that between the hospital systems there and the public health system and the field hospital that they were setting up, that we could put Astria just kind of on, standby, with the understanding that if we needed to, we could stand that up in a couple of days. I think the next slide actually shows me being in Spokane, where I had a great exchange with not only the legislators there, but the media, and was able to spend some time just talking about some of the efforts and how important it is to continue to stay home and stay healthy. You'll also see in the next slide that I've had a chance to go up to Shoreline and see the state lab, and also, so that's on the left that you see there, and also in King County while I was there yesterday, had a chance to visit one of the long-term care facilities in Issaquah. And that was an important aspect to see how dedicated the staff are to making sure that they're doing everything to protect the residents in their long-term care facility. Next slide, please. So here are just some resource materials, because I think that, you know, we all want to start looking towards what does recovery look like, and what do we need to consider. And part of the what I'm looking at in terms of what does recovery look like, I still have to, I still have to maintain that the healthcare workers are protected and they have the protective gear, the PPE that they need, because the way the virus is behaving and the way it is continues to be present, we have not eliminated it, and it is not as contained as we'd like to believe. And so while we've had some success in either flattening or lowering or maintaining the curve, it's not, we would really like to see a more sustained bend in that curve before we can say with a great deal of confidence that something is on the downslope. And so I don't think we're quite there yet. But we do need to start looking at what does it look like if we're trying to think to the future and what we need to prepare for in terms of recovery. The next slide, please. So just in terms of what the state and what the federal governments are doing in terms of supporting their hospitals now, what you have here are the types of supplemental funding that has been available both at the state level and then what's been matched by the federal government. And you can just see that here's what's already been dispersed. And from the lens of the hospital system, I know that with the governor's guidance to eliminate or suspend elective surgery, that has been something that's been a real consideration, and some of the conversations we're having today are when is a safe time to restart that. So just so you know that we're trying to do everything we can to make sure that we maintain the health infrastructure even in these trying times. And if you go to the next map, you'll see, or the next chart, you'll see where those monies have actually been distributed and which counties we've been trying to make sure have the capability to continue to support either the pandemic response or the healthcare needs in those respective areas. Next slide, please. So that's kind of a real top-level view of some of the things that I've been doing here in the state of Washington. There's been a tremendous amount of support and cooperation, and I think hopefully next time, if there is a next time that I can show you, I'd love to be able to show you the statewide dashboard that we've developed so that we have a look at a glance of what's happening across the state in terms of our available beds, our available ventilators, as well as the number of staff that we have available to staff these beds. And we'll be using that material, that information, in conjunction with the DOH EPI folks to understand what they see in terms of where some outbreaks are happening and how we can best make sure that we can contain them and make sure our healthcare system is prepared to help take care of these Washingtonians and get them back to health. So thanks very much for this opportunity, and I look forward to any kind of questions or comments later on. Thank you.
Well, we're really appreciative of the time you're taking, but also the time you're taking to be here in the state of Washington to help lead this effort. I did have a couple of questions. In particular, everyone's looking to the second wave, and what does that look like, and what are the driving factors of that? And we recognize that the governor just yesterday, said that this is a dial and a slow dial, not a switch. What are some of those leading indicators that you're, either hoping to see or hoping not to see when it comes to looking out for that dreaded second wave?
Yeah, so great question, Joe. And I think that, there's the epidemiological understanding of how most of these types of viral infections work. We know that there's probably going to be another wave, another surge sometime around the traditional flu season, which will be in the fall. However, one of the things that the governor talked about, how it's a dial, it really has to do with the fact that we know that there are some communities that are higher risk for the COVID transmission. And one of the reasons that I was in King County was to visit one of the long-term care facilities there, because we know that those types of facilities, or facilities where we have people in groups living situations, they are at high risk for the disease being transmitted. So what we're trying to do is understand how we can best support long-term care facilities, nursing homes, skilled nursing homes, or assisted living facilities to arm them with the right types of PPE in order to protect the staff as they're taking care of patients who we may or may not know right away that they are COVID positive, and then being able to make sure that we have the appropriate testing to assess whether they've been infected and whether or not there's a risk for transmission. So until we have, and so I think the other piece is not only in long-term care facilities, but any congregate setting. So even in some of our shelters and in some of our other facilities or organizations where we have a group of people living together, we know that those are the groups that are most at risk. And so being able to understand where that's happening and being able to target our efforts to contain it as quickly as possible is very important. And so we're trying to use that and approach these different areas so that we can try to contain any type of surge that might be coming before the fall surge.
We've heard a lot about the importance of testing, and there's mixed reports around the world, especially from South Korea, about the ability to really mass test their population. Maybe two questions that you may be able to shed some light on. Is there an effective antibody test available? And then the second question, what's the future for Washington State getting access to that in really mass quantities, so that we're not just testing individuals that are displaying symptoms, but we're testing individuals to get a sense of the broad impact of the disease and also about return to work? Yeah,
I think those those are very insightful questions, and that's exactly what we're grappling with. We did have some type of encouragement that there might be an antibody test, and our early experience has shown that it may not be as specific as we'd like it to be, and as a matter of fact, it's showing antibody or immunity for other COVID viruses and not the one that we're dealing with now. So there's a little bit more work. We had some high expectations, and we were very optimistic that might be a part of our overall testing strategy. So I think there's still some work that needs to be developed in that, but in the meantime, your comment about being able to test on a very broad basis, it remains one of the goals that we're trying to achieve. And how do we get to that with the existing tests, and how do we create a program where we can do pretty comprehensive and regular surveillance, so that we can check to see whether or not the virus is present. That's very much part of the conversation that we're trying to have here. We would like for antibody testing to be a part of that, and until we're sure that we have the right type of machinery and tests, that give us the accurate, the accurate results. For now, we'll still have to remain on the testing. We'll have to depend on the testing with the current nucleic acid assays that we're using now.
Last question for you, Vice Admiral, before we head on to talk to our clinical professionals. There was great risk in the beginning. Washington was the first state to get hit. There was a sense that we were going to get overwhelmed. CenturyLink was transformed into a makeshift hospital. There was concerns about ventilator shortages. Certainly, we've seen a lot of PPE shortages. We did a good job here in Washington of staying home and staying safe, and it did an effective job of bending the curve. Tell us, did any of those ventilator shortages appear anywhere in the state of Washington, and what is the supply line look like for PPE for our hospital workers?
So, we were able, after a little bit of time working with each other, to determine that we actually had the capacity to take care of any surge. And while it looked like we might be kind of close there for a while, had some great confidence in the different hospital systems' agreement to work with each other to make sure that no one hospital or no one hospital system would fail in their response to support patients who were infected with the COVID virus. And so based on that, and with a little bit of planning, we were able to recommend to the governor that it was all right to be able to return some of these ventilators and be able to reallocate or redistribute ventilators and other supplies across the state as needed. And so that's been very helpful in Washington's ability to help other states who have a more acute need at this time. The PPE question remains something that is an ongoing effort, and the governor has been very supportive of that, instructing us to purchase and procure as much PPE for the state as possible, and that he's asked us to take some financial risk in making sure that we can do this. And so about 75% of the PPE that's coming into the state has been purchased by the state. A little bit, about 25% is coming from the Strategic National Stockpile. And then we've got a small amount that's coming from private donations. But I don't think we can have enough PPE just yet. And so our supply chain is something that we're aggressively keeping that primed as well as we can, and looking for other ways that we can either conserve some of the PPE or reuse it safely. But certainly, the more PPE, the better. And this is one of the factors that we're considering in terms of whether or not we can safely start doing other types of surgery in our hospitals. It's really the supply of PPE that we need to make sure is consistent and sustainable.
Vice Admiral, thank you so much for taking time to be with us. I'm sure there's some more questions for you on the back end if you're able to stick around, but we also know that you are extraordinarily busy as you're working through the state to help respond to this issue. But I do want to turn now to some of our medical experts that are joining us. We know that the first cases in Washington State were here on the east side in Kirkland, and Overlake Hospital, or Overlake Medical Center, has been the tip of the spear, so to speak, in responding to those. I've had many conversations with the CEO there. The number of cases, COVID cases that have come through that hospital have truly been tremendous. And we've got a couple of great experts that are going to talk to us about their experience working in the hospital there. And I'm going to start with, I believe, Dr. Edward Leonard. Dr. Leonard went to the University of Pittsburgh Medical School, got his, did his residency at the University of Washington, go Dogs, and for the purposes of the last few months, he has been very important because he is the lead infectious disease specialist at Overlake Medical Center, where so much of this activity is happening. Dr. Leonard, thank you so much for being here and welcome. Dr. Leonard, I see you there, and I think I hear you as well.
Yay, are we on?
Yes, you are. Welcome. Thank you.
Well, thank you for having me.
No, thank you so much. And thank you for your service over the last several months. We know that this has been a very difficult time. Tell me what are you experiencing there at the front lines?
Right now, it's a lot of activity in terms of patient care, predominantly getting the patients in, getting them settled in and treated appropriately, especially in a situation with a virus that we don't have a major treatment yet. So trying to get those patients in and taking care of them right away is probably the utmost importance right now. That also includes dealing with bed supply, making sure we're able to have our negative pressure rooms to take care of the patients appropriately, to get our samples, to do the respiratory treatments that are needed. The secondary component of that, of course, is the educational side, educating our public, our fellow staff members about the viral infection, what it entails, what we need to look for, and how do we proceed from here. Those are the two biggest things I've seen in my experience thus far.
Has there been any sense that some treatments, obviously we've seen a lot of back and forth at the national level in the politicization in many cases of treating this disease. What's your experience actually treating these patients? What has been effective, and how have you found success?
That's a good question. I think it's still a little too early to tell fully how effective the treatments are, but we have been using an old HIV medication called Kaletra that has been shown effective in some Chinese studies, along with an anti-inflammatory medication called hydroxychloroquine, which, based on our experiences here, seems to have provided some benefit. But again, time will tell us if that's the case or not. We have also been lucky to have the ability to use remdesivir, which has been another antiviral medication that's currently under study for compassionate use. And again, there have been some improvements in patients, but again, we'll have to wait for time to pass to see where that goes. So I don't say for sure that these are the panacea, but I am hopeful that they will be very effective in providing us some tools against this virus. The other medications, so for example, chloroquine, I don't have as much experience here, nor do any of my colleagues. That one is still, I think, a jury's out even more compared to the medication I just mentioned. So with more time and more patients to be given the medications, that'll give us a better sense to tell everyone if these drugs are the real deal or not.
What was the surge as far as the patient load at Overlake? How many have you been seeing? Has it started to taper off, or are you still at a full pace?
We have seen a decrease in the number of cases over the past week and a half. Our census in the hospital has averaged around 30 to 32 patients per day. That changes with discharges and the like. When we started out in this process, we were as high as 70 to 75 patients on daily census with COVID. So we're seeing a market decline, and I anticipate over the next few weeks even more of a decline from our 30 or so patients per day right now.
And what about the supplies? I see you've got everyone in the room there is following your social distancing guidelines, and everyone's well masked up. How have been the supply lines of not just homemade protection devices, but actual, the stuff the FDA would prefer us and the CDC would prefer us use? How has Overlake been able to maintain those supply lines?
We have done an excellent job with our procurement teams to be able to have enough supplies available. Along with that, it does go against a lot of infectious disease dogma, which is reusing masks and the like. But that has been very helpful in allowing us to stretch out our supplies to still have PPE available even now during this outbreak. So between those two activities, we've been able to keep a good supply of PPE for our staff and as well as some of our patients.
I have to ask about morale, because we've seen a lot of things on social media and others where the workload and the exhaustion that so many that are these frontline medical situations that they're experiencing. They're just exhausted and the hours are long. How are you and your colleagues faring?
I think we're doing reasonably well at this point. There's certainly a number of us who you can tell are more tired. Conversations are shorter, if you will. There's not as much of the banter that we would hear normally. But I think overall, we're trying to get people to get home, get their rest, come back refreshed, having someone take call for them for their particular service line. And I think those are the things we've been doing to maintain our morale that way.
And finally, Doctor, what can the community do for you? You know, there's been certainly an outpouring of support on social media. There's been blue ribbons on trees. There's been food delivery to neighboring hospitals. What are the top things that the community can do to be supportive?
I think with the things they're doing right now is very important. In addition, continuing to help us with providing supplies for the PPE, as you mentioned, that we need. There are certainly companies and other institutions that may have supplies that they don't need right now. If they can donate those to us and other hospitals here, that would be very important. I think just having the support and the spiritual strength of everyone in the community to help us go forward, and knowing that that's there is probably the most important as well.
Thank you, Doctor, so much for being a part of this conversation here today. I'm sure we've got some more questions coming in here as well, but I'm going to briefly move on to your colleague, if that's all right, and come back with some additional questions for folks at the end. Our next guest is Dr. Thomas Miller. He is the Medical Director for Quality and Safety at Overlake and is a 37-year professional at Overlake Hospital and was named top doc in both Seattle Magazine and Seattle Metropolitan Magazine. So it is great to have you here. It is also great to have another University of Washington residency individual here. So tell us, you know, you're seeing this, you're having to change the entire way that the hospital operates in some regards to accommodate this type of illness and these types of PPE shortages. What's your experience?
Well, that's a broad question. Thank you for having us here today, by the way. This has been a situation that I never anticipated I would be part of, but it has been very gratifying to be part of. We had our first COVID patient identified February 28th. That was a Friday night, and from the point of identification of that patient until now, this has been essentially 24/7 operation. We mobilized that night, established our incident command center, got all of the personnel that we needed in leadership, made sure that we had a direct line of supply to the units. We had negative airflow rooms ready and set up. And since then, it has been frontline battle each day. So it has been quite an experience, unique in my career.
What are some of the things that you've had to do in your position as the medical director for quality and safety to change the operations of the hospital, to take into account the unique nature of the disease and to take into account all of the things that we don't know about the disease?
I would say two things. The science around this virus, its transmission, its epidemiology, and the steps necessary to take care of our patients as well as our staff were changing fairly dramatically, almost day to day, as we had this onslaught of patients. And the communication of that changing horizon and scenario was very critical. We had to make sure that we got the message out to our frontline staff and providers, what was the most recent and best information that we had, make sure that we had the supplies there for them to be able to follow those best practices. And the second part was the supply of the material itself, making sure that we had not just supplies that we had stored and getting those mobilized and made available, but we had to be quite creative in being able to repair material. We actually had some old, what were called pappers, shrouds and air purifying material that were left over from the Ebola crisis that weren't functional, but we were able to find a company that could 3D manufacture some small parts, and that enabled us to fill the gap until we got more supplies for protection for our staff. So it has been a matter of supply and also a matter of agility with critical communication about best practices as we go along.
I was at the King County Council staff back in the 2008-2009 timeline, and I recall the many meetings, and I think there was a purchase of something of 1 million doses of Tamiflu or something along those lines as we geared up for preparation for H1N1. Did any of those preparations, any of those plannings inform how we've responded now? Is there anything that, that we wish we would have done either at the local or the national level to be more prepared?
That's a difficult question for me to answer. I can only answer from our standpoint here at Overlake. I think, again, the treatment for this in terms of medications and pharmaceuticals is unclear. So we have been able to procure some supply of medications for our patients, but we don't have a storehouse of that medication in-house or region-wide. So I think as we learn more about this, perhaps we can prepare for the future with medications as the science informs us what works. We may be in a better position to be able to get ready for the next wave if it occurs. But I think because this is indeed a novel coronavirus, we don't know exactly what works best. We have had some success with both pharmaceutical and non-pharmaceutical interventions, but we're learning as we go.
One of the things that the Vice Admiral brought up was the return to elective surgeries. I've had some experience following healthcare finances, and I know that the shutdown of elective surgeries has put a giant hole in the budgets of most hospital systems, but certainly has shut down many smaller ASCs and other facilities. What's your sense about what Overlake is preparing to do in terms of turning the switch back on for elective surgeries? Is it about an internal conversation to figure out how to do it safely, or are you waiting on guidance from state government?
Well, we have been preparing for a gradual tiered ramp up to some return of elective procedures, but we will certainly not pull that trigger as a flip the switch sort of phenomenon. This is something as we follow the census of COVID patients at our facility and see what is going on in the region, we will start to think about how to implement a return to a more normal workflow. We are very sensitive to the financial aspect of it, but the safety of our healthcare providers and our patients has to be paramount. So it will be a balancing act. It will be a very gradual, tiered sort of re-implementation of normal practices. Again, we'll have to see what we do will be based somewhat on what happens in the community.
Dr. Miller, thank you. I wanted to jump back over to Dr. Leonard for a quick second for a question about mutation that's come in here from one of our participants, one of our viewers. We hear a lot about the dangers of mutation. In many cases, mutations can make things easier to cure, not harder to cure. What are we seeing? Are there 8 different strains of this virus floating around the world and with different impacts? Are we seeing it rapidly changing, or is there something that we've learned and can prepare for?
That's a good question. As of this moment in time, we believe there's only a single strain worldwide. There have been some studies recently that have looked at the viral sequence that have shown some mutations within the genomic sequence. We're not sure what those mean yet. They're doing more evaluation of those viral strains, but hopefully, as you mentioned, these mutations will allow us to take care of the virus much easier and possibly to create new drug targets and or immunotherapies like vaccines. So that would be the hope going forward.
And what is that sense from vaccine development? In the early stages, it was anything shorter than 18 months is a pipe dream. Just a few, I think, hours ago or days ago, Dr. Fauci indicated that it may be in the year plus timeline. We know there's 60 plus labs that are hard at work at it right now. What are you hearing on that front?
I'm hearing more of the 18-month timeline. University of Washington, a little over a week ago, started enrolling their first patients in one of the early coronavirus vaccine trials. So given how we know that these studies are done normally, if everything goes beautifully well, no hiccups, no complications from the vaccine, saying that it's effective, and then the next step of getting it ready for public consumption.
I want to jump back to Dr. Bono, Vice Admiral Bono, if she's still with us. In particular, I wanted to ask about the collaboration between healthcare systems. We've seen some of our great professionals here at Overlake, but my question is, what kind of formal partnerships are currently underway, either in the treatment of COVID patients or in the development of potential vaccines, cures, or research?
So, we're seeing a lot of collaboration and partnering in a lot of different ways. The one that's most evident to me right now are how the hospitals are working with each other to make sure that nobody has to get overrun in the care of the patients. And so what we're actually seeing are hospitals being able to share supplies like ventilators and equipment and PPE with each other so they can continue to take care of patients at a very high level across the state. And what we were able to also see in the eastern region, which is something that we already saw here on the western part of Washington, is how hospitals are working together to make sure that the patients in their community stay within their community and that no one facility has to get so overrun that they are not able to take care of the patients successfully. So there's been a high degree of collaboration and partnering that has been really what has allowed us as a state to help other states out, either with field medical hospital or ventilators.
Dr. Miller, if you're rolling there, I love that. You're rolling right into frame. That's just that's great. One of the questions that's come in that is actually kind of interesting is, from the very beginning, we've known that there's been those quote unquote vulnerable populations, and those have been fairly well documented about who falls into that category. Have the patients that have come into Overlake fallen into that rubric that was set from the very beginning? And also, where are the folks that are coming in now since the stay-at-home order was put in place? Where are they catching this disease? Where are they coming from? Are these essential employees that are more out and in the workforce? Are these infections that just went undiagnosed and took longer times to incubate? What's your sense?
I think certainly the majority of the patients that we've seen here have been in that cohort who are at highest risk. Those who are above age 60, those who have other comorbidities that predispose them to a more serious infection. Some have been outside that cohort. And we don't know exactly what the reason is that they have gotten ill, but often it's family contact, or in one case, we think the patient was infected on the job at a child care center in contact with lots of children who, as we know, may be minimally symptomatic, and that person, we think, probably got ill in that setting. But in general, it has been the typical cohort of patients who are at risk that we've seen here.
You actually brought up an issue that I did want to ask about, mostly because I'm locked in my basement right now. It's the only place I can get a moment of peace and quiet for my 1-year-old and my 3-year-old, because of course our childcare facility is closed. But my wife and I are working from home. So what are your staff people doing? Many of whom I know have families. How are they making do with finding adequate childcare?
Well, we here at Overlake actually have the good fortune to have an off-site specialty school that we have repurposed for childcare for our employees. So those employees who have to work and who have school-age children, or others who are not able to secure childcare otherwise, we have that available to them. Go ahead. Sorry.
Oh no, that's great news. That's wonderful news. I will drop my youngest off soon. Is there a special story or experience or something that's happened over the last month in dealing with this that stands out as something that is noteworthy, or something a staff member or a patient or a family has done that sticks out in your mind?
You know, there have been so many. It's really difficult to put a finger on any one. The patient who was in their 30s came in and had to be quickly intubated and rescued, was treated with some of those medications that I mentioned, and who was then extubated and able to be discharged, was a real success for us. We also had a 100-year-old patient who was here for quite a while and ultimately was able to be discharged. And those are the stories, the successes that we really live for. That's why we do this. The other thing that I would say has been the community support, and both in terms of supplies, in terms of food for our coworkers, and just expressions of support, the cards, the notes, that the thank yous that we get. In many ways, I feel as though it should be the other way around. We should thank them rather than them thanking us. But this has been, I think, a real highlight of my experience.
Well, I'd like to remind everyone that's watching right now, that there are special staff designees at each of our Eastside hospitals that can serve to help coordinate delivery of food and other essential things for the staff at our medical centers. So if you need that information, if you want to get involved in helping these folks, please contact us. I'm going to run through and give each of the three of you an opportunity to sort of sum things up for us before we close today. And I'll just start by asking if there's one thing that you need, if there's one thing that you'd want the public to know, if there's one thing that you'd want the public to do, what would that be?
Well, from my standpoint, it would be continue to social distance, observe the shelter in place request. That's what keeps our numbers down, and ultimately, I think will allow us to return to more normal states sooner. And thank you.
Thank you, Dr. Leonard.
I I echo Dr. Miller's comments about the support, as he mentioned. I would also like to tell people to exercise patience. This is a rapidly ongoing, moving target. As we get more information, it will certainly be dispensed out, and we will do all our best as healthcare providers to get the help and care that people need, along with the knowledge. But it will take time. So patience is probably the biggest thing to ask for.
Admiral Bono, the last word goes to you.
Oh, thank you very much. And I would have to echo what the other doctors mentioned. Part of our success in making sure that we are available to take care of as many patients as possible means that we must continue to do our part to stay home, stay healthy. And even though it's very trying, one of the things that people should also take away from this is that the leadership at the state level here is very much involved in making sure that we're doing everything that we can. And we're seeing that same level of commitment from all the leaders across the state and in the counties and the cities. And so the best thing that we can do is continue to keep our numbers as low as we can while we're doing as much science and research to find those tools that will allow us to more effectively deal with this virus. I think that fora like this, where you invite the public in to hear some of this, can only help everybody's shared understanding of what they can do to make sure that we're as effective as possible in combating this pandemic. So thank you very much for this opportunity to be a part of your conversation today.
Vice Admiral, Dr. Leonard, Dr. Miller, we are incredibly grateful not only that you took the time to spend with us and answer some of our questions today, but we know that you are three of the busiest people in our state right now. While many of us are shooting videos in our basement, you're saving lives and traveling throughout the state and putting yourselves at risk, along with your colleagues at risk for the benefit of all of us. And so we are very grateful for all that you're doing. We hope that you will reach out to us in ways that we can participate, either as we start working towards the way of safely returning to work and getting information out to businesses across the region so that they can be well informed about best practices to keep people safe, or if we can find ways to partner in improving the morale in your healthcare environment, because we know how hard that your folks have been working. And you all should know just how grateful each and every one of us is for the work that you are doing. So thank you again for participating. Thank you all for spending some time with us over the last hour to learn about the healthcare response to COVID. We've got several more great webcasts in the hopper over the next few weeks that we hope that you will tune into. If you have time right now in 5 minutes, I'd invite you to switch your radio dial over to KJR 950 AM, where my brother Dick Fain will be interviewing Governor Inslee, and hopefully continuing this great conversation about how our state is responding to this crisis. And I'm sure they'll just talk about sports some, which probably will be a nice break from all of the heady issues of the day. Again, thank you so much for joining us. As always, please reach out to the Bellevue Chamber if we can be of any assistance. Our call center is operational. Our website is getting updated. We're trying to promote those businesses that are open and operating so that our community will continue to use them and patron them, and also provide those resources to those businesses and individuals and families that need extra help. Again, thanks so very much. Stay home, stay safe.